United Nations Office on Drugs and Crime is one of the key agencies of the UN. For 2 decades, the United Nations Office on Drugs and Crime has been helping make the world safer from drugs, organized crime, corruption, and terrorism. It is committed to achieving health, security, and justice for all by tackling these threats and promoting peace and sustainable well-being as deterrents to them. The scale of these problems is often too great for states to confront alone. Therefore, UNODC offers practical assistance and encourages transnational approaches to action. UNODC does this in all regions of the world through their global programs and network of field offices. UNODC has been working in Pakistan in close collaboration with the government of Pakistan and civil society with the purpose of addressing development challenges specifically related to drugs and crime. Together with the government of Pakistan, the UNODC has developed its second country program in order to ensure that its support is clearly directed towards strategic priorities and meets Pakistan's needs. To ensure coherence and efficacy, the government of Pakistan and the UNODC have jointly agreed to outcomes that will contribute to peace and stability, complement government's policies and programs, assist Pakistan achieving international commitments, and engage with UNODC mandates. The development process has been built around mapping exercises, strategic consultations with donors, and baseline assessments. The second country program is not a static document but a dynamic framework that can be adapted as it is implemented according to changing needs and priorities. It is focused on 3 interdependent domains: illicit trafficking and border management, criminal justice and legal reforms, drug demand reduction, prevention and treatment.
Bismillahirrahmanirrahim. Assalamu alaikum and welcome to Diplomatic Enclave. I am your host Omar Khalid Butt. Ladies and gentlemen, the United Nations is a very important organism. Pakistan joined the UN in 1947, less than 2 years after the establishment of that organization. Now, the United Nations has a very trusted and close partnership with Pakistan, and we have many organizations that are under the auspices of the UN that are working in Pakistan in a very diligent and responsible manner. One of those agencies is the United Nations Office on Drugs and Crime. It is a very important organization that not only deals with all kinds of drug-related incidents, but also with corruption, something that our government is also trying to remove as we speak from the society. It's a difficult task, but nevertheless a step in the right direction. We've been joined by the country representative of the UNODC in Pakistan, Jeremy Milsom. Jeremy, thank you very much to have joined us.
Thank you, a pleasure to be on your show.
Jeremy, first of all, is this your first visit to Pakistan, your first deputation to the country, or do you know about the country? Have you visited it before as well?
Well, I knew a bit about Pakistan before. In the past 10 years, I was before this posting in Uzbekistan for 5 years and Afghanistan for 5 years. But in Uzbekistan, I was managing a regional program covering Western Central Asia. It's a hat I still have, actually. So that is Pakistan, Afghanistan, Iran, and the 5 Central Asian countries: Kazakhstan, Kyrgyzstan, Tajikistan, Uzbekistan, and Turkmenistan. And that program, we were bringing the 8 countries together to discuss issues on a regional basis. So I had visited Pakistan a number of times before in this capacity.
All right. Jeremy, as you said, you are also taking care of a lot of Central Asian countries as well, and Afghanistan as well. You are the regional director as well, so you take care of all of these countries as well as Pakistan. What similarities do you feel that all these countries have as far as your domain is concerned, that is crime and drug?
Well, UNODC, we have this special mandate and we have to support all member states around the world, and we work at country, regional and global level. The bulk of our work's actually on a country-by-country basis, so supporting capacity in development in individual countries. But drug trafficking, criminals, by their very nature, they don't respect borders, and if we are to make a difference, we need to join hands and work in a regional basis and international basis to have an impact. So the countries of the region are facing similar problems. They're facing problems of drug trafficking, of preventing abuse of drugs in their country, of countering the crime associated with drug trafficking and illicit financial flows. And so it's like a common enemy, and the countries are joining hands and in many areas to actually work on this at a regional basis in addition to a national basis.
All right, Jeremy, do you feel that there are similarities amongst the Central Asian countries and Pakistan as far as the way you deal with them?
Yes, actually, it's interesting. When I started the regional program, there wasn't so much collaboration between the countries in many of these areas, but bringing the countries together, we've found similarities, common ground. We've worked on issues for the very first time. Countries are able to share their experiences with each other in many of these fields and learn from each other. So it's actually a refreshing cooperation under the blue flag, both learning new things from countries but capitalising on similarities as well.
All right. Speaking of your experience, you've been associated with the United Nations since around more or less 24 years. You've been to the Pacific region, you've been to the Southeast Asian region, and now you're here since some time. How, in your point of view, has your experience with the United Nations enriched you as a person and as a professional?
Well, it's a privilege to work for the United Nations. I mean, you get to live in different countries and meet people. You learn so much. In addition to your field of expertise and contributing, you learn so much from each of the countries. And I've had successes and made great friendships every step of my career throughout the past 24 years. So it's a privilege, and you get a lot as an official as well.
All right. Jeremy, being associated with the UNODC, you of course get experience on hand, a first hand, a second hand or a third hand experience in your respective field. Going through all the different countries, the way they deal with drug and crime, could you elaborate on whether all the mandates or the objectives of the UNODC can be implemented in each and every country, or does it differ from region to region or continent to continent?
All the countries I've worked in are party to the various treaties and conventions and instruments, and that in itself, that's the first step. That means the countries are committed to making a difference in drug, countering drug trafficking, in countering transnational organised crime. So it can vary from country to country. Some countries will have a greater capacity in one field and lesser capacity in others. For example, one area in which we work is in strengthening forensic capacity related to drug interdiction and crime interdiction. And depending on the budget available in different countries will have different capacities. And then there are opportunities by bringing countries together for countries which are more advanced to share their expertise and knowledge with others. But generally speaking, I've had very positive experiences and making progress in all the countries in which I've worked.
So what are the basic mandates or the objectives of the UNODC for those who do not know or those who are trying to learn?
Well, UNODC, we used to be the drug control program, and then in '97 we were merged with the Criminal Justice Division to become the Office on Drugs and Crime. But now we're a very specialised agency with quite a broad mandate for one of the smaller UN agencies. We deal with illicit drug trafficking and precursor trafficking, and there's many aspects to that. So in countries that are producing illicit drugs, we work in the field of alternative development, in which we help people who are growing, say, poppies, who are dependent on the income to go into legal livelihoods, and so they won't have to grow poppy anymore. Actually, Pakistan had a very successful program decades past and was able to successfully stop cultivation in this country many years ago, making it poppy free. And then there's the whole prevention and treatment side when it comes to trafficking. So drug markets are constantly evolving and changing, and we constantly need to work together to get proper messaging and understanding of the drug issue. Effective treatment, science-based treatment, treating drug use disorders, which is a health disorder. And also a very specialised field, HIV prevention among vulnerable groups. People who inject drugs tend to have a high incidence of HIV.
And hepatitis.
And hepatitis, correct. It's a strong vector for the spread, so we partner with other agencies there. That's the illicit drug trafficking. Then we have the whole crime prevention issue, and we work on all aspects of crime prevention and rule of law. So this is strengthening police capacity to engage with communities, to investigate crimes, to protect evidence, to ensure that evidence is preserved effectively and used in courts, right through to prisons. Then human trafficking and smuggling of migrants, other forms of trafficking and such as cybercrime, wildlife and forest crime, firearms trafficking. Then the whole issue of money laundering and illicit financial flows. That's a very, very important and growing area where we work in Pakistan and in the region. If we can deprive criminals of their ill-gotten assets, then that's a big blow to criminal enterprise. Then we also have the counter-corruption mandate, prevention and strengthening the capacity of governments to counter corruption, as well as prevention and suppression of terrorism. So where for an agency we have a very broad and very important mandate.
You have a very broad mandate, but how do you kind of work on that? Because there's so many different things that you've just mentioned that we will also discuss in detail a bit later in the program. But with so many different mandates, with so many different objectives, how do you manage it? Is there a subhead for each category? For illicit drugs, is there one for prevention of HIV use? For corruption, is there another? Or does just one person yourself deal with all of this?
Well, no, we're able to engage in all these areas in Pakistan, and we divide it into 4 pillars. The drug trafficking and human trafficking, border control, cybercrime, first pillar. And I have a pillar lead for the 4 pillars. Then the rule of law, criminal justice, then the health approaches and the treatment and prevention and the counter-terrorism. 4 pillars, 4 leads. We're a very agile agency. We're able to work all around the country at the provincial and federal level. So we're able to respond and work in partnership with Pakistan on all these issues.
All right. Speaking of Pakistan, or speaking of the world in particular, because under the auspices of the UN, you work with more or less all the different countries in the world. Is there any country where you've had issues working within or working with the government? I'm talking globally. Without naming, have you had any issues with certain countries as far as cooperation in the field of, say, corruption or illicit drug trafficking is concerned?
There are various treaties and instruments that we oversee, and not all countries are party to all of those treaties and instruments. So those countries that are not party to the treaties, we work with them to help bring them to a point where they can ratify and become party to the conventions, treaties and instruments. So there are countries that are not yet working on these issues. Often it relates to areas where there are serious security issues. So, but we work on these issues, and we do focus on those member states where we need to build this cooperation.
All right. Now, you being part of the UN, first there were the Millennium Development Goals, now they are the SDGs. Which are the SDGs that refer to your organization and that you have to follow in letter and spirit and fulfill?
Well, the United Nations as a family, we're working very hard towards being one UN. So there are many UN agencies, and we don't want any duplication or overlap. So each UN agency has a particular and important piece of that overall, the Millennium Goals, the Sustainable Development Goals. So for Unodc, of course, one of the most important ones is Goal 16 on access to justice. We have, and then many of the others on health, on the environment. UNODC's mandate, because crime and drugs undermine society, undermine health, it's like a cross-cutting mandate that contributes to the achievement of the Sustainable Development Goals. The drugs and crime issues, taking away from having an illicit economy, undermines security and stability in society. By addressing those issues, then we can have a big impact on a stable society in which there can be fair and equitable development and sustainable development. So we're an important part of the UN family. We work in partnership and we're supporting the Agenda for Sustainable Development and the Sustainable Development Goals.
Of course, the United Nations also works with donor countries and donor organizations. Are those donor countries or organizations also divided per organization? For example, does the UNODC receive grants from a certain organism or a certain country and others don't, or is it just a general donation from different parts and quarters of the world that the United Nations works with the help of?
Well, UNODC's mandate's very important. So there are two ways that countries give funding to the UN, to UNODC. We have general purpose funds. That's where a country makes a general commitment to funding the organisation to achieve its objectives in the countries around the world. Countries also have, particular interests in particular issues. So countries may have a specific interest, say, in human trafficking, smuggling of migrants, and give donations specifically to that pillar. So we have both general purpose funds and then funds tailored to pillars as well.
All right. That is because it was just by curiosity. I wanted to understand whether how the whole donation system works and which countries or organizations donate to the UNODC. As far as Pakistan is concerned, what have been the challenges that the UNODC has encountered over the years, and what does it feel it needs to work upon even more in the years to come?
Well, Pakistan has many challenges related to, there are a lot of drugs being trafficked. There's a problem of drug abuse in the country. So we work closely with the government to strengthen the responses on this issue. In terms of strengthening responses to drugs and crime as well, that's very important to have robust, transparent, evidence-based processes through policing and judiciary. So there are lots of challenges, but I feel quite fortunate. I feel I've come to Pakistan at a time when there's such progress, and I can say that because I've worked on the regional program for 6 years, so I've been engaged with Pakistan prior to coming here. And it's just in the last couple of years that many doors are opening. There are new law was adopted in human trafficking, smuggling of migrants in 2018. There have been new prison laws as well. So
of course, speaking of challenges, and you were giving me more details about the challenges that Pakistan faces and the work that Pakistan has done. You said that there are new laws that have been put into place since 2018 that of course coincide with your mandate.
Yes, well, as I said, I think I've come at a really interesting time because we're seeing a lot of commitment in Pakistan to making a difference in these issues, and it's across so many areas at once. So with the adoption of a new law in human trafficking, smuggling of migrants, we're working with counterparts to get action and put that into practice. There's been great commitment in relation to prevention and treatment of drugs. So we're working across government ministries on new initiatives on a regulatory framework for drug treatment to improve quality assurance and access to treatment for people with drug use disorders. Also, in the rule of law, we actually work on many of these areas to counter illicit financial flows. The government has obligations under the FATF process, so we're seeing a lot of progress in this regard on working on the mechanisms and the interministerial mechanisms and reporting mechanisms to have stronger nationwide action on illicit financial flows. So it's there are lots of challenges here, but we're enthusiastic working with our partners at the moment to really make a difference.
All right. Speaking of partners that you say are making a difference for your work in Pakistan, there's the Ministry of Narcotics Control, and then there is the Anti-Narcotics Force. The ANF has, if I understand well, 5 different mandates of a certain strategy that it calls the SPEAR strategy, that includes surveillance and criminal intelligence acquisition, proactive prevention and protection, effective enforcement, alliances, assistance and cooperation, rehabilitation and awareness. How much does the UNODC help and assist the ANF with this?
Well, the Ministry of Narcotics Control and the Anti-Narcotics Forces are important partners. They're our principal partner on our Pillar 1 on countering drug trafficking, precursor trafficking, border control. So we have very active programs on the prevention and treatment side and the rehabilitation. We work in partnership with MNC and ANF on this whole process I was referring to before. We're looking at data management systems to improve drug reporting and connectivity between police and drug investigators around the country to get stronger and more consistent action on drug trafficking and reporting. ANF has also been a very active partner in the regional work. So when you look at regional work, I mean, Afghanistan, Pakistan and Iran are seizing more illicit opiates than any country in the world, which is testament to the commitment of these countries. They're illicit drugs which are not getting further afield, so it's a great contribution to the work in the world. And a lot of that, it's not all based on countries operating on an individual basis. It's countries talking to each other, sharing information, coordinating their work. Often when you see a drug seizure, it's not the result of one country, but it's a result of this important joint work between administrations, both within the country and further afield.
All right. Now you mentioned while you were talking about your cooperation with the ANF and the Ministry of Narcotics Control of your capacity building interventions in the reduction of drug demand. Could you give us a bit more detail on that?
Well, again, and it's another area where Pakistan's been leading in drug use prevention. At the Commission on Narcotic Drugs, it's an annual meeting where all the countries come together to review the conventions and treaties. Pakistan sponsored a resolution which was adopted by consensus by all member states as 61-2 in 2018 on prevention in education settings. So that was an initiative of Pakistan, which was taken up by other countries. And so building on that, what have we done? So you don't want resolutions just to be pieces of paper sitting on shelves. So it started with a regional conference with participation from the 8 countries I cover, but in addition, other experts from around the world to discuss, you know, what's working, what types of prevention programs are getting through to young people and so on, and sharing experiences and best practices. And then, you know, on the heels of that, then practical programs. So here in Pakistan, we're implementing a program called Universal Prevention Curriculum, where we, and another one called Strengthening Families Program, where we bring schools, families, communities together to discuss drug problems. And these programs, science has shown that they reduce risk-taking in young children. They're based on training of trainers. So we're getting a pool of trainers in Pakistan that have passed a training that's accredited internationally and can train other people, so it's sustained here. So we're working on this. I mean, more needs to be done. It needs to be consistent. It needs to be expanded. So it's a very important area of work.
Now, all the efforts that you are doing in collaboration with the government of Pakistan need to be expanded, and the cooperation needs to be more strenuous, more strong. But we are encountering a pandemic nowadays, that is the COVID-19. Now, what is the vulnerability, for example, of one of the segments that you work for, that is the drug users to the COVID-19? When I was reading the statistics, I read that around 35 million people suffer from drug use disorders, and over 500,000 die each year. Women opioid deaths also are up 92% in a decade. Now, with this COVID-19 pandemic slowly and steadily gaining ground or not in parts of the world, how do you deal with it?
Well, the world has changed, and we're all dealing with the COVID-19 outbreak, and it's posing particular difficulties. Let me perhaps answer that in two parts. So, yes, the World Drug Report showed 35.6 million drug dependent people, 269 million used drugs in 2018. That's up 30% in 10 years. That's a reflection of population growth, but it also, unfortunately, is the fact that drugs are more prevalent than ever before. They're more potent than ever before, and they're diversifying. More and more new drugs, especially synthetic drugs, are coming onto the market. And the mortality, yes, as you said, that's from the 2017 Global Burden of Disease study cited in our report. 585,000 people in 1 year lost their life. So that shows you just how serious it is and how we need strong evidence, strong knowledge, strong understanding. So with COVID-19, one thing we're finding is the drug problem's not going away. You know, nothing's changing. There are still seizures. Traffickers are trying to find new ways to work in the environment. People addicted to drugs are still trying to find their drugs and suffering hardship. So we need to learn to work and adapt in the COVID-19 environment. Here in Pakistan, across all the areas of work we did a comprehensive analysis and document, so how we are working in COVID-19 across all the areas of our work. In those areas I referred to before, our specific role within the UN, we've done some emergency support, we've repurposed some funds, but a lot is learning to operate in the COVID-19 environment. Now, going then to drug users, this is difficult, this is very serious. I mean, we see the UN treats drug users, people with drug use disorders, it's a health issue. It's a multifactorial health issue that needs to be treated as a health issue, not a crime issue. So these are people, for whatever reason, there can be genetic factors, environment factors. Often people are driven to drugs through socioeconomic and severe hardship in their life. So we need to continue to support these people with serious health disorders. And with COVID-19, of course, the medical responses in Pakistan are focusing on COVID. It's emergency and emergency treatment, so non-emergency health conditions, and with the lockdown and the issue of stigma, it's difficult for families to go out, for people to get support. Drug patterns are changing, so it might not be possible for some people who would normally get their drugs on the street to get those drugs. So there'll be a lot of people around the country in a difficult situation, perhaps going through withdrawal. People with drug use disorders are vulnerable. They have often have compromised immune systems, so potentially more susceptible to COVID. So it's a very difficult situation at the moment, and we're working with counterparts that we work with in the country on ways we can respond, on outreach, on getting more telehealth services to these people. But it's a serious problem.
I'll have to kind of stop you there. You talked about telehealth services. Now, in countries such as Pakistan, where there is a segment that takes drugs but is not having access to social media or even telehealth services, how do you reach out to such segments of the society?
Well, very good question, and it's something we need to do a lot more of in this country, in Pakistan. What we were just piloting, just when this COVID-19 hit for the first time, was a rural drug treatment program. Now this is something we've done successfully in many other countries around the world, where we actually work with communities, with local health officials in remote settings where they might not have access to social media, and families to have community-based treatment, detoxification, get the community to understand the problem, treat it as a health condition, not stigmatise the person, and work, right in the far grassroots level where people might not have access. These programs have been shown to be successful, and we were just piloting here, but COVID-19 has struck. So we're looking at what we can do in the COVID-19 environment. I don't have the answers yet.
But you are looking at alternative solutions.
Yes, yes, and it's an approach that we are piloting and want to do a lot more of in this country to address that need, which you so rightly pointed out.
All right. Well, crime rate. With COVID-19, do you feel that the trends of crime or the range of crime has changed? Has it been affected globally, regionally, or in countries such as Pakistan?
Yes, absolutely, it's changing. I mean, COVID-19 has changed the world. The socio-economic impact has changed the world. So the nature of crime is changing. Some crimes are more difficult. New forms of crime are emerging. Unfortunately, criminal networks, one thing they show they can do is they're very agile and they can adapt very quickly to take advantage of difficult situations. And it's a challenge also with socio-economic hardship. There's a massive increase in socio-economic hardship around the world. It means that people on the very edge of poverty may be, potentially pushed into crime. It means, on the other side, criminal networks who may take advantage of shortages in the market by controlling the supply of essential goods and price hiking and things like this. So it's changing the way, it's changing the nature. We have to be just as agile. Unodc globally, we're doing a study into this at the moment. We're taking, because it's all real time, it's just happening now, so we're taking examples from all over the world of how criminals are taking advantage of this situation and the sorts of responses we can put in place by working with governments, police and communities to prevent it.
All right. What about capacity building interventions? Do you feel that they have been affected somehow by the COVID-19? Have you modulated them to work under this environment?
Well, again, a good question, because the bulk of what we do in Pakistan is actually capacity building. The country's, signed on to international instruments and treaties and international standards, and our role is to help the government build up the capacity of all the governments and all the departments and line ministries and work together to respond effectively. And so right across the spectrum of our work, we do capacity building. We have been able to move a lot of it onto virtual means, teleconferencing. In some respects, it's helped us improve connectivity where we didn't have as much connectivity before. With e-justice, for example, is one example. So we're actually every single week doing many capacity building activities and events virtually online. We just recently, for example, completed 3 nationwide seminars on gender-based violence, on different aspects of gender-based violence, because this is a phenomenon that's been increasing all over the world.
And gender-based violence has increased. I was recently talking to a lot of experts who said that the women especially are the vulnerable segment, because the men are staying at home and they are subjected, those who are already violent in nature, they subject their wives to even more more violence. So that creates a turbulent atmosphere in the houses.
Yes, exactly. We're seeing it here and we're seeing it in countries all over the world. People locked down with all the additional stresses and So it's a difficult situation. So we've just completed 3 seminars, one on how the police can work more effectively to address this problem in the COVID-19 environment, and reporting mechanisms, one on e-justice and one on support to communities and survivors of violence. They were very well attended. These were joint seminars between Unodc, UN Women and UNFPA, and very well attended by officials from all levels, from all over the country, and an excellent dialogue and discussion on this important issue.
All right. Let's talk about another important issue, the Pact to Counter Terrorism, or the Project to Counter Terrorism, or PACT. How has the cooperation between Pakistan and the UNODC been in this?
Again, it's been really excellent. The PACT acronym stands for Pakistan's Action to Counter Terrorism. So the initial program was implemented in Khyber Pakhtunkhwa, and it was focused very much on strengthening the capacity of government to respond. So all aspects from training of first responders, protection of crime scenes and protection of evidence, moving that into judicial processes, witness protection, protection for the cases as they're running, right through to ensure that court cases are done in line with international standards, with fair trial and everything else. And that was a very successful program, and our counterparts in KPK can also talk about that. So on the basis of that, it was implemented in Sindh. So we're expanding that program to Sindh. But on the basis of both of those two, together a couple of months back with the Minister of Interior, we launched a nationwide program with the difficult acronym PTP2. It's like a tongue twister. But that's expanded into a very comprehensive approach. So the law enforcement capacity building and judicial processes, then victim support to survivors and families of victims of terrorism, then very importantly a advocacy and outreach component where we'll work throughout Pakistan right down to the grassroots level on education, on working with communities to understand risks, on preventing radicalisation among young people, which is a problem. I mean, these are challenges facing countries all over the world. And then also on more international and regional cooperation. So this work with the Ministry of Interior, the National Counter-Terrorism Authority, the Counter-Terrorism Directorate and the Ministry of Foreign Affairs. It's really a pleasure to work on this. It's exciting. We're making progress and strengthening the country's capacity to deal with these issues.
Awareness raising is also something that is very important, Jeremy. Now, in these times of COVID-19, what measures are being taken by the UNODC in that respect?
Well, awareness raising is really, really important, and here it's a partnership of all stakeholders. The media is a partner, communities are a partner. We need to work together to get understanding of the issue. This year's Drug Day, our drug report, Better Knowledge for Better Care, it's all about getting science and understanding, extending that to all aspects of the community so we can have more understanding of the issue and address it collectively. And we've been doing a lot in advocacy. I mean, we do work with the government on drug messaging, but we've also been doing advocacy work with our counterparts on working in the COVID-19 environment as well. We've had specialised training with police, with judiciary, with prisons on how to work safely around these issues in the COVID-19 environment. Because as I said, I think right at the start of the interview, the nature of drugs is always changing.
Exactly.
New
more
drugs
and more
are coming
drugs
onto
are
the
coming
market.
on the market.
And so we always need to be reviewing our messaging. We always need to be updating our knowledge, and we always need to be ensuring that we're connecting with all the stakeholders in our society to raise that awareness, the understanding of the dangers and address effectively.
All right. So, of course, you work with the police, you work with the different jails in the country in order to build that awareness about the different issues related to drug use and, of course, crime. And that is a very important thing, because awareness building also changes your mindset about how you deal with crime, how you deal with drug use. And I think in areas such as Asia, Southeast Asia, Afghanistan and other countries, Central Asian countries, it's very important to bring on that message. So awareness raising becomes even more important. Now, the role of society in media to combat drug use. Do you feel that the UNODC has done enough in that respect, or is it a constant challenge for you?
It's an area where we need to continue to be very active and do more. There's stigma associated with drug use, and to deal with that issue we have to break down that stigma. People who suffer from drug use disorders are our families. They might be our brothers or our fathers or our mothers or our children, and we need to get that message and the understanding that they're a part of society, that they're cared for.
They're not alienated.
Exactly, exactly. And in this, the outreach, the media, we're all stakeholders together. We're all partners in achieving this.
All right. Now, you talked about the World Drug Report that comes out every year, and also the theme of this year is better knowledge for better care. Have the two kind of, how should I say, complemented each other, that report, and why have a theme like better knowledge for better care this year alone, and why is there any specific reason for that?
Again, it's a good question, and I think, as you know, you can see it with COVID-19, with this pandemic. It's been a challenge to get facts out there, and rumours spread fast, and misinformation spreads fast, and in a very well-connected society, it's very challenging to make sure that people get facts and we dispel these rumours. It's the same with the whole drug abuse issue. I mean, it's there's misinformation, there's misunderstanding on drugs, on the dangers of drugs, and so the World Drug Report is a knowledge product, and it brings all the knowledge of all the member states together each year into a factual, objective report based on science, on how we can effectively respond to the drug issue and the crime issue and those afflicted. So better knowledge for better care, the World Drug Report as a knowledge product. It's divided online into 5 easy-to-read manuals, and encouraging people to get connected, to build understanding of this issue and to work together to solve it.
Now, on the 9th of December every year, the UNODC also commemorates the International Anti-Corruption Day. Now, the current government is also endeavouring, as have been the previous ones, to end corruption from the society, from different segments of society, from different institutions as well. How has the collaboration been so far?
It's been very positive. The government of Pakistan is a signatory to the United Nations Convention Against Corruption, and as part of that partnership then we work with government to strengthen capacity, transparency, reporting, to address and strengthen the transparency of processes. So we work on capacity building with our partners, in particular the National Accountability Bureau. There are many aspects to it in terms of prevention. I mean, there's a lot of steps we need to take. There's a lot of things we can do. One area where we've had particular early success, or we're making good headway, is in asset recovery. It might not be well known, but through my regional hat, in the last couple of years, an asset recovery interagency network has been set up in Western Central Asia, and that was initially discussed here in a meeting, regional meeting, sponsored and hosted with the National Accountability Bureau. So this is working effectively now. It's something we helped set up, but is run by countries, not by us, and there's the important thing, it's greater sharing of information between countries, requests for information and sharing of information, sharing best practices investigations and following paper trails, electronic evidence, this sort of thing. So good progress there. And again, we have a strong partner here in the government of Pakistan. The commitments there, we're working on these aspects of capacity building.
You also work in that aspect with international organizations such as Interpol, maybe, or the CIA. Do you also help and assist them if required?
Not with well, we work with Interpol, yes. We have partnerships with international organisations. Those sorts of partnerships are very important. It's important that support programs, whether they're bilateral or multilateral, don't duplicate what each other is doing. So coordination is important. And yes, we often when we have events, we'll have speakers. We've had Interpol speakers as experts, for example, at events we've done on electronic evidence.
Jeremy, so many different avenues of cooperation between Pakistan and the UNODC and also with other countries and the UNODC. But being Pakistan specific, how do you foresee the future between your organization and our country?
Well, it's been a real pleasure since I first came to Pakistan. I've travelled around the country. I've been to Karachi a number of times and Lahore and Peshawar. I've met many of our counterparts in many ministries and provincial governments, and it's been wonderful actually. I've developed great relationships with all our counterparts. I feel and see incredible commitment to make a difference and to make progress on all the areas that we're addressing. So I really feel I've come here at the right time and that we can achieve a lot in the coming years.
All right, Jeremy, thank you so very much to have given us the time, to have given us such a lot of information of different topics on different avenues that the UNODC has been working on very diligently in Pakistan and across the globe. And I really wish that this cooperation between the UNODC and Pakistan continues to prosper, continues to strengthen with time. I really hope and look forward to certain trainings that you could give to different people like the superintendents of jails or those who are organizations who are addressing crime or addressing drug usage, or even the media partners, so that they are better knowledgeable, more knowledgeable in order to kind of deal with situations that you have a mandate for. We wish you all the very best, Jeremy. I hope that a year or two down the lane we'll be interviewing you again and you'll have so much more to talk to us about what you have done in those 1 or 2 years. We wish you all the very best. We wish Pakistan and UNODC also all the very best in their cooperation. Ladies and gentlemen, that brings us to the end of this show. We'll see you again next week, same time, same channel. Stay happy, stay safe, and stay crime-free. Allah Hafiz. And thank you so very much, Jeremy, to have given us the time and that much of knowledge and insight about the UNODC. We wish you all the best.
Thank you. A pleasure.